And to me, it's like, people are like, why are you running a water challenge? It's because of the results. It freaking works.
Absolutely.
Yeah.
My 13-year-old really got on board with it last time, and she has still been keeping up with it.
I love that.
Awesome.
Can you talk about more the role of blood sugar in POTS or in headaches?
Yeah, absolutely. It was just, I didn't appreciate that, the highs and particularly for me, the lows in blood sugar were just really sending
Huge.
my symptoms all over the place. It was messing with my sleep at night. So I was waking up because my blood sugar was going too low. And so, of course, that messes with hormone production and, feeling fatigued all the time. And of course, that contributes to headaches, not getting enough rest. And so that was a huge piece of me being able to get better quality sleep.
So globally, you're saying that the blood sugar helped with the POTS, with the sleep, but also with the migraines. Can you give us one big change that was like a big aha for you with the blood sugar thing that was like, wow, that really worked?
Making sure that I had some protein and fat before bed.
Yeah.
That was a huge piece for me. Having that little bit of protein and some fat helped me to get better quality sleep. And I wasn't waking up at 3 and 4 a.m. all the time.
Do you have an example of a protein and fat before bed?
A lot of times,
Test quiz.
I'll do something really simple like a mug of ginger tea.
Yeah.
And I'll put some collagen peptides in there and a little bit of MCT oil because I do have a hiatal hernia, so I am prone to reflux. So I try not to eat something really heavy. Having that helped was just enough to level out my blood sugar so that I wasn't, even if I do wake up now at 3 or 4 a.m., I can usually go right back to sleep. It's not my blood sugar keeping me up.
I was going to say it's very similar to Christina, and I was also kind of venturing into the land of dysautonomia and was getting dizzy. And for me, it was needing to make sure that I ate something within an hour of waking up every morning. And it couldn't just be, grab a granola bar or grab something as I was heading out the door. It needed to be, again, high protein, high fat snack. And so for me, my morning routine is now a big mug of almond milk with collagen peptides, MCT oil, and I add cacao, and that to me, and a little bit of vanilla extract, and it's a little bit of coconut. And to me, that now tastes sweet. My boys taste it and they're like, what are you drinking? But because I've cut the sugar, it's delicious. And if I miss that, or if I miss having something like eggs or something, I'm dragging for the rest of the day, and much higher likelihood that I'm going to end up with a headache.
Well, what you're telling me is one of the concepts we teach in our program with Blood Sugar Mastery is what I call bookending the day, which is that you got to start that first thing in the morning with that protein and fat hit, and you got to end the day with that as well. And for those of you that are watching who are in our Facebook group, or you're watching from YouTube, I talk about my bedtime routine with that whole fat protein mix and golden balance, how I make my golden balance, which is our golden milk from our store. It is the best selling product from the store and the most rebought. And one of the reasons is because it freaking works. It's like herbs that really help balance your blood sugar at night along with the collagen. And then I love using it with half coconut milk and coconut cream to actually make my golden milk at night with the golden balance. So to me, like that whole idea around the protein and fat is huge. And you got to bookend your day with it.
And also, Meg, too, for me has become a bit, and this taps into the mindset piece. For me, it's ritual. In the morning is, waking up, and I look forward to having that moment with my frother, that looking forward to that nourishment. And I miss it if I don't have it, especially working in a medical field. I had gotten very good at not drinking anything during the day, because if you're going from patient to patient to patient, there is no time to go to or at least, let me rephrase that. I thought that there wasn't time to go to the bathroom. And I realized that, I know you can relate. And so you get in this very bad habit of not drinking any water. And then I'd get home, I would feel horrible. I'd have a headache, and then I'd be downing water and then awake all night because I was going to the bathroom. And so really realizing that making hydration a priority, not only was it necessary, I also realized I had every right and permission to hydrate and to take care of myself, and that it was okay to stop and go to the bathroom, particularly since I was working in urology at the time.
So ironic.
I know. So I was sitting there telling people all day to drink water, and then I'm not doing it. If my hydration falls off, if I go lower than that half my body weight in water every day, that's when I know that, especially the next day, I'm at much higher risk for ending up with a headache.
Huge.
And so have to really watch that. And it sounds so simple. And once you incorporate it into your life, it does become simple.
Check out Transform Autoimmune Disease Naturally and join our Facebook group, because a couple times a year I run the 10-day water challenge in the group, and we're 36,000 people in the Facebook group right now. It's a huge challenge for us to run. And to me, it's like, people are like, why are you running a water challenge? It's because of the results. It freaking works.
Absolutely.
Yeah.
My 13-year-old really got on board with it last time, and she has still been keeping up with it.
I love that.
Awesome.
Is there any role of supplementation that was helpful in dealing with migraines for either one of you?
Well, in addition to the MCT oil and the collagen, for me, the B12, if I forget to take my B12, I notice very quickly. Omega-3s, I had started just before I started your program. Someone else had suggested omega-3s to me, but then after your program, I bumped it up. And really helpful, not just for headaches, but joint pain too.
Super secret, okay? Latest research in autoimmunity, and I know the latest research because everything in our program is data-driven, okay, is that the dosing of omegas, of a high-quality omega that you need to calm down autoimmune disease, okay, it's about 3,000 to 4,000 milligrams a day, which is why I love the fact that you want a vetted fish oil, and our Pro Omega 1000 is 1,000 per capsule, making it easy. You just take 3 of those a day, anytime in the day. I like to take it at night. I take all 3 at night because omegas are going to be super helpful with hormone balancing, anti-inflammatory, and sleep. So for me, omegas is huge, and it's a big deal in autoimmunity. But specifically, omegas are really big in migraine headache management, actually.
And then the B12 too, like realizing I needed the methylated B12. I needed a good quality B12, not just, those additives they put in all of those.
Well, and you learned in our program too that there's definitely some nutrients that are really important in autoimmunity, and understanding your test results accurately is huge with that, because so many people are being lied to because their doctors don't even understand how to accurately assess B12 levels, truly intracellular B12 levels.
For me, it was also looking at like the individual lab results. And for me, it was actually realizing that I needed to adjust my thyroid medications a little bit. I needed to switch to something that included T3, and definitely the vitamin D, vitamin B12. The other thing too that I have really started adding, again, to address the barometric pressure thing, is Sinuplex. And anytime I I know that if it's going to snow here in Philly,
it's actually snowing right now in Portland. It just started. I'm looking out my window.
You're like, stop it. But I know that, okay, if there's a snowstorm, I just automatically take Sinuplex just as a protective measure, and it really makes a huge difference.
What's cool about Sinuplex is that it's got high-dose quercetin, which is really great as a natural antihistamine to decrease any allergic component. It's got stinging nettle in it, which is the strongest herb that you can take when you're dealing with allergies. It's got some vitamin C, NAC in there, bromelain there. It's really our powerhouse for dealing with an allergic component to this. So was there a sinus component to your headaches in the past, Merritt?
You know what? There was from time to time. It was challenging because it was hard to distinguish, was it a migraine that felt like a sinus headache? Or was it a sinus headache that felt like a migraine, or was it some combination of both? And I did in the past have some success with using Sudafed, but obviously didn't want to be doing that. So being able to find something more effective and healthier was really important. The other thing too, in talking about supplementation, is for me, it wasn't necessarily just one or one supplement or this supplement. It was the combination of things that were individualized for what my body and what my data showed that I needed. Because it was, I felt like I had spent years saying, oh, well, they said to take this supplement or try this supplement or do this, do that. And I was feeling like I was piecemealing things together the best I could.
Yeah.
It was only when I had all the knowledge all at once that you really saw the change happen and happen quickly.
What people don't realize in our main program for Transform Autoimmune Disease and in my hormone masterclass is that what I've hidden in the hormone components is actually a liver cleansing protocol. There's a huge component of liver that's involved with hormone balancing, and there's a huge part in liver for blood sugar balancing, and they're all linked. And liver is one of the largest organs in your gut. So how can you heal your gut if you ain't dealing with your liver?
Well, I joked that I needed liver love because, and I didn't even know that I needed that. I think it's a continuing process. And I think that's the part that's so important too, is that it's not just you're done after 8 weeks and then everything's magically better. It's an ongoing learning process. And I think that's what's so valuable about this program is that there's really ongoing opportunities to learn and to grow and to talk with alumni, and really just pays for itself in spades.
Absolutely.
We also have videos in the Facebook group that explain specifically what is so unique about our food mapping process that's different than anybody else. And I think, Christina, you had mentioned that, a lot of people talk about food sensitivity testing or intolerance testing as boohoo and bunk. And the truth of the matter is there is a lot of really poor testing out there. A lot of these mail order tests, even a lot of testing that you do with providers is really crapola. But I think the most important piece is not only do you need the right test, but I think getting the right education to understand that autoimmune people actually have a lot of false positives and false negatives. So even if you do the right test, but if you were never trained on how to understand what a false positive or negative is, it's bad. It becomes bad data. If you know there's somebody that actually could benefit from watching this later, put their name in the comments and they'll be able to see it later. Thanks, everybody.